My name is Philip Calder. I'm Professor of Nutritional Immunology at the University of Southampton in the UK. For the next few minutes, I'll be talking to you about the health benefits of the modulation of fatty acid intake. In our diet, or in artificial nutrition formulas, there's a variety of fatty acids. These belong to different families according to different structures. It turns out that different families of fatty acids have different functional activities, and even within a fatty acid family, the different members can behave differently. The main effects of fatty acids on cell and tissue function occur as a result of the incorporation of those fatty acids into cell membranes. Through their incorporation into membranes, fatty acids change the physical nature of the membrane and the way the cells respond to other signals. Some fatty acids can also affect the production of hormone-like mediators, for example, prostaglandins and leukotrienes. Finally, fatty acids can affect intracellular signaling pathways, leading to changes in gene expression. So different fatty acids can affect the way cells and tissues respond to signals through effects at the membrane and the nucleus and through the production of different types of lipid mediators. In addition, recently it's been discovered that there are specific receptors that respond to fatty acids, meaning that fatty acids behave in the way that transmitters or hormones respond, at least as far as some cells are concerned. Because different fatty acids act through these different mechanisms, different types of fatty acids will affect cell function, tissue function, physiology, and therefore health and likelihood of disease. It's hard to generalize the effects of fatty acids because of their widespread activities on different types of cells and tissues. But as a general rule, saturated fatty acids induce adverse health effects. For example, raising blood cholesterol through their effects on liver cholesterol metabolism, and also directly influencing metabolism through the activity of saturated fatty acids on classic inflammatory receptors like the toll-like receptor 4. At the other end of the spectrum, omega-3 fatty acids, for example those from oily fish or fish oil supplements, seem to bring about positive metabolic consequences on the liver, on adipose tissue and skeletal muscle, and also on inflammation. And again, these fatty acids are working mainly at the membrane level and through changes in gene expression. In between these differential effects of saturated and omega-3 unsaturated fatty acids, we have the monounsaturated fatty acids and the omega-6 fatty acids. In general, the monounsaturated fatty acid, oleic acid, found in the Mediterranean diet has health benefits, although these are less marked than those of the omega-3 fatty acids. Finally, the omega-6 fatty acids, essential fatty acids found mainly in plant oils, are rather complex to comprehend in their entirety because they have beneficial effects on cholesterol concentrations in the blood and therefore act to lower cardiovascular disease risk. But on the other hand, they give rise to inflammatory mediators and may increase the likelihood or the severity of inflammatory responses. So through these types of mechanistic and functional understandings, we're getting an increasing picture of the broad range of different fatty acids according to their families and according to their specific structures on cell and tissue function that impacts on human health and risk of disease and also offers therapeutic possibilities for people with disease. This is probably most well recognized in cardiovascular disease, but is also important in inflammatory disease, in cancer, and in metabolic diseases like type 2 diabetes and obesity. Undoubtedly, there'll be much more work unraveling the differential effects of fatty acids on human health and disease over the next years. Thank you very much.